Dr. Ryan Cedermark of NeuroSolution firstly, but also IAFNR. Absolute pleasure to meet you today. Recently, M2MMA did a partnership with IAFNR, and you're the man who put me in touch. And I'd love to learn more about your journey. And firstly, how did you get into functional neurology to start with?
Yeah, man, thank you so much for having me. When Kyle connected us, I thought this would be just a wonderful partnership for everything and everyone. So, my background, I'm a chiropractor. I went to school at Life University in Atlanta, Georgia, but I don't come from a chiropractic family. So, in school, we learn a lot about the philosophical sides of healing and how doing an adjustment can really help change the nervous system. But that answer wasn't good enough for me. I needed something more in depth. I wanted to understand why, if you're doing work like physical modalities with a concussion patient or with a brain injury patient, how is that improving their sensory brain? How is that improving their visual brain? How is that improving their memory? And so at the time, there's an institute called the Carrick Institute out of Florida. They were teaching graduated chiropractic professionals advanced certifications in neuro rehab, essentially. So it was a 300-hour neurology course you could get board certified in. So that, I had a doctor that was kind of my mentor at the time. He's like, you need to stop going to the gym and study more. So he got me into that, and it really resonated with me. It just made sense of my profession and gave me a lot of focus throughout my whole chiropractic schooling. And then I sat for the board as soon as I graduated and just started to work with a lot of neurologically challenged patients ever since the gates opened. So,
Was there something in particular that inspired you to go down this path?
man, that's a great question. I think back about that often because like a lot of my buddies give me a hard time. They're like, dude, you're a chiropractor. Like, what are you doing working with brain injury, with stroke, with severe concussions? And it was actually a concussion patient that really made me stick because the first couple of years out in practice, man, they're tough. Like, you have what you think is all this knowledge, and then you're trying to create a business out of it, create opportunities for yourself, start to pay back your student loans. And I was having a hard time doing all that. And at the same time, too, I was back in school getting my nurse practitioner license. In the States here, you can work under a medical provider as a nurse practitioner and serve essentially as like a primary care provider, prescribing medications, taking people off medications. And I always wanted to have that dual licensure. So I was actually kind of on the verge of, I don't know, man, this is like, I like it, but I could just do the nurse practitioner thing and have a good professional career. And there was this one kid who flew in from Alaska to see us. I was working in the city at the time, and it was a tough case. He was referred in from a veteran that we worked with that we had great success with. And he lost the ability to speak several days after his concussion. He was an ice hockey player, got cross-checked in the middle of the ice, severe whiplash, really, really bad concussion. And I'd never seen a concussion manifest that way physically. But, in my mind, you've got a 16-year-old kid who's extremely intelligent, like top-level athlete. In Alaska, they don't play hockey for fun. They play hockey to play hockey. So I worked with that kid, and it was probably just the culmination of things. My wife and I at the time had just had our first boy, and I felt a higher power calling to say, like, I've got to help this kid, and I didn't know what I was going to do. It was the work that we did, all the training that I had done, that essentially over the course of several days, doing several hours of therapy a day, he began speaking again. His concussion symptoms just started to lift. He flew back to Alaska a few weeks after being in the States, and then a month or two later he's texting me on the side like, hey, my dad's gonna ask if I can go back to playing hockey. What are you gonna say? So it was one of those, just like, that's gonna stick with me for the rest of my life. They become family friends, and that's kind of just led me down the path of, I've got to figure out more of this to try to help more people who have been told, like, hey, there's really nothing else to do except watch and wait. So yeah, that was a long story, but yeah, that kid means a lot to me, man.
No, but that's why I asked the question, because sometimes we end up in life where we are and we forget what led us, what was the journey to take us to this place. And when we start talking about, in this case, an athlete or injuries that perhaps are really affecting someone's lives, the fact you're able to step in and assist them must be a very rewarding thing for you.
Oh, big time. Yeah, and like I was a 16-year-old kid. I used to play hockey, so there was just all these things where you just know you have to know something that could help, and yeah, it was pretty impactful. So
And do you think, in regards to concussion in particular, it's something that perhaps we're learning more about as time's gone on, but maybe it's one of those, issues, and certainly in health and in sports, that perhaps people haven't looked at enough, and there's not enough information around how athletes can recover, potentially, reduce the risk of, and so on.
yeah, that's a great question. It's funny because that was almost 8 years ago, and if he came into my office today, I think the way that I would begin working with him would be different, just based on all the new stuff that I've learned. But for that time, even then, like he was kind of, and I don't know how healthcare works in Alaska, but he was assessed, and then he was kind of siloed into these different professions towards these experts, like a speech therapist who works specifically on speech, a physical therapist who works on some of the physical things, and at the end of the day, they were basically told, like, hey, this is all we've got for you, which they did some good work with him, but he was still so concussed. And some of their recommendations to me were a little antiquated. A lot of the social isolate, just rest in a dark room, don't do a lot of physical activity. The research has shown that a lot of that stuff isn't actually good for your brain for multiple reasons. So he was kind of, you take a 16-year-old kid, this vibrant, intelligent, athletic, social kid, and then he's isolated, he's not back in school, he's not challenging his brain, he's not playing the sports that he loves, he's not hanging around the people he loves. And for me, that alone can just continue to have a negative impact on the brain. So I think there's still so much to learn in concussion and in brain injury. I'm very hopeful for the future. I started working with him when I just started learning about the benefits of photobiomodulation or red light therapy. So that was all new for me at the time, but I attribute a lot of his gains clinically and just symptomatically to using stuff like that. So I think the future is bright. I think more people need to realize the healing power of the nervous system. Don't ever write off a symptom. Um, you know, we have a very resilient, innate intelligence within our body and in our brain, and there's ways to tap into that. So as a practitioner, I'd say to another provider trying to learn some of this stuff, you've got to push yourself to learn what's new and what's out there. And it might not be that there's a depth of research behind it, but there's so many new amazing modalities that can help people that really need it.
And if you were to describe like functional neurosciences and the role in which you play, it seems to me that that's almost quite applicable to what you just mentioned in terms of a much broader perspective on an injury and the different aspects and how you can treat that injury.
It is. We were teaching this past weekend at the clinic, and it's funny because online, like sometimes you'll get these armchair quarterbacks. They're like, "You're not a neurologist. What are you doing talking?" And I never want to present myself as a neurologist. I'm not. I work in the rehab space, but I have I'm very confident in how much I know about neurology. And I think that is where the difference is in functional neurological applications in terms of rehabilitation of symptoms. And the reason for that is when you really start to learn the way that the nervous system develops and it grows and it starts, and the way that it communicates, so the way the brain and the balance centers or the sensory brain talks to the brainstem, when you start to learn those communication pathways, you can assess and evaluate a patient and determine, even though we have all these even though we have all these symptoms that the patient's complaining about or these physical deficits that they're presenting with, you can assess them to look at what systems are broken down from this specific injury. Like, where in the nervous system are things not working? And even though they have all these symptoms, if they don't line up, where do we start our therapies to help build those systems back up? And a lot of times in concussion, the evaluation is mostly based on the higher executive function areas of the brain, kind of like the frontal lobe, the bigger part of our brain. but people aren't really assessing the autonomic system, the survival system, which is your brainstem. There's not in-depth look at the cerebellum or the balance center, which plays a role in cognition and attention and all that stuff. So I think learning the lens to look through and to evaluate the patient can completely change the trajectory of someone's symptoms, no matter how bad the concussion is. And that's really, I think, where functional neurology shines.
And if we look at athletes in particular throughout impact sports, are you seeing more and more in the work you're doing now? Is this, again, as people reporting concussion symptoms and some of the issues associated with that on a more regular basis to you?
I think it's being spoken about more. So people are, and I don't know, because, I've never been in a combat sport myself. I've never done that. But working with patients who've been in sports, in combat sports especially, but then also very physically challenging sports like gymnastics, soccer, we're hearing more about symptoms, and patients are being more open about like how they're feeling, because the biggest complaint is like they just feel off. They don't feel like they're themselves. And I think because of some of the newer things out there, maybe people sharing their stories on social media, people are more comfortable with, coming in and talking about it, because they're finding out that there are ways to help, there are ways to treat it. So yes, to answer your question, but I think there's still a lot of people out there that maybe are also not seeing the right providers and not hearing the right answers from people that truly understand what's happening in the brain. And just a good example of that is we had a gymnast come in it was over a year ago now. And essentially in Atlanta, Georgia, we've got some of the top pediatric neurologists in the country. And she was told, and her mom was told, like, hey, there's nothing wrong. We did all the scans. Her balance is good, which it was. She's just going to have to take some time. And gave her some medications. Kind of told her the same story that the young guy was told. You got to stay away from sport. You got to, all the stuff. And so by the time she came into us, there was zero hope left, because the story in her mind was that, this is only going to get better with time. There's nothing out there that will help me. Essentially, there is nothing wrong with me. So I think that's part of it too, is, you've got to keep digging for answers if you just feel like something's off.
So what would be your recommendation? Let's say if a combat sports athlete was sparring and they feel like something's off afterwards. I think that's one of the nature and one of the issues we're discussing here is that, in any impact sport, whether or not it be football or hockey or combat sports or rugby, you have to be tough, right? You have to push through barriers. You have to push through rules, the very nature of the sport. But where's that line when you should start to say, hang on a minute, something's not right here and I need to go see someone like yourself?
I would say, I tell patients, they know their body best. If you feel like something's off, even if it seems very minimal, like if your reaction speed is off, if you're not quick, if you're not as sharp as you used to be, if your focus isn't there during, a sparring event or a fight or something like that, if you just start to lose focus easily, if you have a lower endurance, both mentally and physically throughout training sessions, if you just feel like something's off, that could totally be concussion related. And there's a whole host of reasons why. And, it doesn't have to be a major blow to the head to cause repetitive concussive symptoms that are truly subclinical. I mean, I remember reading research papers years ago where they referred to concussion as a silent epidemic because there was no true testing at the time. There wasn't anyone that's really looking at the multifactorial symptoms and causes of concussive symptoms. So my advice would be is if you feel like anything's off just a little bit, start looking at it, because the longer things are slowed down, or if the longer that those symptoms linger, there's something called negative neuroplasticity. Those negative pathways will start to form and you'll just continue to get slower and try to manage your ways around them. But there's ways to improve it and intervene pretty quickly.
Yeah, I think that's one of the things, especially in combat sports, that a lot of athletes perhaps don't realize they're stepping into their fight on their big night, potentially compromised by what's happened throughout their training camp. And I think that's especially where M2MMA wants to step in and help athletes track their data, utilize our technology, working with people like yourselves to keep an eye on that kind of thing, right? So again, and if things pop up and the system flags that they're noticing, changes in the trends or in the analysis, then you can again perhaps go see someone like yourself, Ryan, or adjust your training protocols to make sure that when you do step in on your big night, you're in the best possible position to fight at your best and actually lower the risk of yourself getting hit. Because I'm sure reaction time is something that you probably see quite prevalently is associated with concussion. Am I right?
Oh, big time. Yeah, and so to your point too, like getting some sort of baseline neurological function test, not like a baseline concussion test like an impact test, but looking at how your balance is as a baseline wherever you are today, kind of get a benchmark and see like how fast is the front part of my brain working, which is reaction, speed, focus, concentration. How well am I balancing on normal versus perturbed surfaces today? How well are some of my movements? What about cognition? Like get some of those baseline tests, and then if you start to feel off, retest, and then look to the people who know how to rehab those areas. That's vitally important, especially too. Like our goal always is to intervene, provide the stimulus, and then create change in the brain that's lasting, so that you don't always have to do stuff. And our goal is to always, in my mindset when working with patients, is we're running an ultra marathon, right? Like there's not just one thing that you can do once where the brain's going to change and that's going to stick and sync and link in the brain. You have to do things repetitively. So if you're in it for the long haul and you want to be a contender and a fighter for the long haul, you've got to do things that's going to provide the right stimulus to your brain, allow proper recovery, and just create more fuel to the cells, so that neuroplastically, even if there is an injury, you're more resilient and you can bounce back faster.
It's a great point, but I think that's one of the things we want to get out there to fighters in combat sports. There's actually things you can be doing to prepare your brain for the impact it's going to take during sparring, through competition, and also in recovery, and actually being active in that. Because when you talk about things like reaction time and balance, those are two essential parts of combat sports. So if you were to say, let's say a combat sports athlete comes into you and says, okay, cool, I've got a fight in 12 weeks time, here's my training camp. From your perspective, what kind of baseline testing would you do? Perhaps in an ideal world, how often? And then how would you kind of track that and look for certain differences and change over that training camp?
Yeah, we would, kind of like the things I mentioned earlier. We go through some objective balance testing. We would combine that with some cognitive-based exercises and testing as well. And then a lot of looking at the eyes. So a lot of assessment of visual function, but not to see how well your eyes are moving. The eyes are a direct window into the brain, and they can tell us what parts of the brain, the sensory brain, the executive function brain, the balance brain, those eye movements can give us a really good benchmark of, hey, this part of the brain is actually working very efficiently, or this area needs a little bit of work. And by reassessing those types of tests every few weeks, you can kind of see, hey, they're doing good. There's resilience in their training. They're not super fatigued physically or mentally. And yeah, so I would say, multifactorial testing, that's typically what we do in the clinic. And then trying to test every few weeks or a month or 2 months out, just to kind of see how you're doing along the way. And then based on those tests, create some recommendations on, hey, if your training is this hard, these are some things that you could do, not only for recovery of your body, but also recovery for the brain. Because if the brain and body aren't talking well, there's going to be a breakdown somewhere.
Yeah, I think that's in combat sports, people talk about some of the greatest fighters of all time being very cerebral is the term they use, right? Because they see things before it's happening. They obviously tactically as well. But even I always look at someone like Floyd Mayweather, right, in his prime. And as you've seen in these slow motions again, you talk about the eyes. Eyes are pinned wide open when three people are throwing punches at him. Now, there's a guy who's, again, I don't know, but it looked like his brain was wired in as in prime position to fight. So it seems like there's a huge opportunity here to train the brain to improve your performance.
Oh, big time. I mean, I know you know this better than me, but like if there is a millisecond of loss of focus and concentration during a fight, you're susceptible to injury or losing that fight. Like that's all it takes. And it also takes, I say this in the clinic, it takes a ton of cortical juice, or it takes a ton of brain juice to maintain your focus and attention and concentration no matter what you're doing for a sustained period of time. Some people can only make it several seconds, and then they have to kind of recalibrate their system. But in order to be a top contender, just like you mentioned, like Floyd Mayweather, he's dialed in and he's locked in, and that's not just because he's motivated. Like he's changed and trained his brain to be able to do that, because that takes a ton of energy to be able to do that, and it's also just so important, even more so maybe sometimes than the physical aspect, right? Because if you're more dialed in than your fighter, you're waiting for them to kind of make a mistake or other way around. So yeah, it's pretty cool to think about it that way.
Yeah, well, that's kind of was going to be my next question, because, I played a different sport, but I love the topic of how the brain works with, the psychological and physiological, and how, and certainly the elite performance, how they're so in tandem. And you mentioned that it can actually be more important how physically prepared you are, because I've seen an example. You see sometimes that you watch sparring, okay, and you see the young kid who is ripped, look as fit as anything, and you can guarantee could outrun the guy in the other corner, perhaps a little bit older, but far more experienced, much calmer under pressure. And the young kid will gas out after 4 rounds of sparring, and the older guy will go 12 with 3 different partners, right? Because his nervous system is so primed for that fight, right? And he stays cool under pressure. And is this something also that you guys, the work you do, that you can help athletes train for?
Yeah, that's huge. I mean, you don't want to blow your gasket right out of the gate, because then everything just starts to shut down. So I think part of that comes from a lot of cognitive based therapies, like learning how to work through those long fights, those difficult situations. But I think it also is a subconscious effort of the nervous system, where some of those pathways have been stimulated so many times that it almost becomes a walk in the park. Like it's much more it's much easier to have that part of the nervous system be turned on and stay turned on for the older, more experienced fighter than it is for the young guy who's totally ripped and looks like he's gonna come out and beat the guy up. So there is a lot that you can do with that, and I'd say it's pretty cool with the way neuroplasticity. I feel like, and it might just be because of my algorithms and what I'm interested in, but neuroplasticity, the whole concept of the brain can change at any age. It can change for the better or the worse depending on your daily habits and the repeated stimulus and your environment. But it's really neat where the research is going. Researchers are trying to figure out ways where they can externally or transcutaneously on the skin stimulate the nervous system through different big nerves that are housed in the lower parts of the brain to create more brain resilience, to improve focus and concentration, to create that sustained energy that sometimes other people will lose. So it's really cool.
That is fascinating, because again, something I've seen throughout my life, both competing in sports and watching sports. I don't know, maybe I have this thing, I almost feel like I can look at someone and tell if they're going to be a winner. And it's just in their eyes. And I know that's maybe a strange thing to say, but if you look at the greatest athletes of all time, in those high pressure moments, they look so comfortable. In their eyes, you can just see they're so locked in, whether it be someone like a Tom Brady or, from my previous profession, Tiger Woods, right? And the other thing is they're breathing through their nose. And this is another aspect in terms we talk about the brain, psychologically or neurologically and physiologically. I don't know if there's something from your side of things as well. I mean, I see young athletes, and you can just watch them in training. They've got the eyes, they're breathing through their nose. Where does that play a role in terms of how athletes can come and work with people like yourselves, and perhaps, again, like you just mentioned, train that aspect of performance?
Yeah, I mean, so those guys that are dialed in, let's just take the nose breathing, for example. So if you look at the nervous system, it's usually taught that there's 2 sides. You've got the sympathetic fight or flight side, or the parasympathetic rest and digest. If you are in a crucial moment in any athletic performance or anything like that, your nervous system is usually going to shift into a fight or flight response, a sympathetic response. With breathing, that makes you become more of a rib cage breather, and it dampens a lot of input into important cranial nerves that send safety signals to your brain. Now, I know this might sound a little bit woo-y, but this is true neurological science. So if you're in a situation where you're in more of a fight or flight state, if you can consciously shift into a more parasympathetic rest and digest state, which you can do through nasal breathing for multiple reasons. One of the reasons is when you're breathing in through your nose, there's bigger nitric oxide production, so you're oxygenating the vasculature more, which is going to in turn oxygenate your brain more, but you're also pushing more of a belly breath physically towards your body, which is going to drive more vagus nerve function, which the vagus nerve is our longest cranial nerve, and it creates more of that parasympathetic rest and digest energy into the system, and it calms the system down. And it also releases what's called acetylcholine, which is your focus, attention, and concentration neurotransmitter. So by being able to consciously shift state, even if you're in a stressed out state, you're setting your brain up for success, and you can learn how to do that. We have a hyperbaric oxygen chamber in the clinic, and we have patients who are claustrophobic but didn't know that they were claustrophobic. So as soon as we start to zip it up, they shift into that fight or flight response. Before they go in, we'll walk them through like, hey, these are some breath work exercises we want you to do if that happens, because you're totally safe. You might just not feel safe, and then sometimes it gets them through it, sometimes it doesn't. But being able to tap into that, just that alone can be a huge game changer.
Yeah, someone to look for this weekend, and obviously the UFC are fighting in the White House, is Alex Pereira. He's another one who every time I watch and the way he stands before his fights, he's famous for his stare downs. But I almost think in those moments he's preparing exactly what you're talking about, whether or not he knows it or not. And then when you watch him fight, again, it's all nose breathing, his facial expression, everything looks so calm and so composed in those moments. So keep an eye out for that this weekend. Just to finish off, mate, it's been a pleasure talking to you today, but can you just tell me a little bit more about the role with IAFNR and again how the organization works and how people can get in touch with it?
Yeah, man. And sorry, the AC just turned on here, so does it sound a little windy on your end?
It's fine. I know what Atlanta's like in the summer. Don't worry, I spent 6 years in the southern states of America.
I try to cut it off during these podcasts, but I don't know. Well, anyways, my involvement with IAFNR, so we're a multidisciplinary, basically a neuro rehab group of practitioners. We have MDs, PTs, OTs. We have parents who are working with their children that want to learn some of these applications. So we're mostly a professional-based nonprofit organization that are just trying to create a big community and a big network of like-minded professionals that want to help people who are really looking to change their brain. And we work with tons of patient populations. We have a huge pediatric population where we're working with children with neurodevelopmental changes in the brain. We've got a group of practitioners that are focused on stroke and traumatic brain injury, but then we have guys who are in sports performance, concussion recovery. So we've got a great group of people, and I've been on the board for over 8 years, and I've been a part of it since I was in school. So we're a really great group, and most of us know each other. It's a small group, but it's a vast network, and we're all connected. So we'd love to stay in touch and help your community just be their best selves. That's always the goal. Is if you're looking for brain recovery strategies, if you're looking just to build your best brain, there's a lot of guys and girls out here that can do it. So yeah, and then I'm also the clinic director of NeuroSolution Center of Atlanta. We've got a neuro rehab clinic here, and we do, I think great work with anyone that's got a brain. So yeah.
Cheers, Mal. That was a great way to finish, and we're absolutely delighted to be partnered with IAFNR, and of course already NeuroSolution over in the UAE, and Dr. Kyle's on our advisory board, of course, and
yes.
That's what it's all about, right? It's giving combat sports athletes the best and the easiest access possible to people like yourselves who can help them with their brain health and performance. And you guys will be integrated into our M2 Intel platform, where athletes will just type in their location and be able to find the nearest IAFNR registered member and put the two together, and we hope to see athletes that are both performing at their best but also better protected from brain injuries down the line.
100%, man.
Thanks, mate. It's a pleasure to talk to you today, Ryan. Cheers.
Yeah, thank you. Thanks, everybody.
Cheers, mate.
Cheers.